Hi, my name is Karen Vinsek. I'm a graduate student in UNE's Masters of Applied Nutrition program, and this is my capstone project presentation titled Amino Acid Supplementation and Mucositis, a systematic review on the effects of glutamine among individuals undergoing treatment for hematological cancers. Here are the objectives for today's presentation. I will begin with a discussion on hematological cancers and the treatment-related nutrition impact symptoms. I will describe mucositis to provide background on this health issue and its associated concerns. Next, I'll outline the procedure I followed for the systematic review. The results of these studies will be explained, and the significance of these findings will be interpreted. There will be a critique of the research methodologies utilized in the selected reports, and I will conclude with recommendations for future research. Cancers of the blood are called hematological cancers, and they start off in the cells of the immune system or the bone marrow, which is where blood cells are made. They're characterized by an overgrowth of abnormal blood cells that divide and replicate rapidly. These diseased cells crowd out healthy cells that have important functions in the body, such as transportation of oxygen, fighting infections, and clot forming. Hematological cancers make up approximately 10% of cancer cases in the United States, and the three main types are leukemia, lymphoma, and myeloma. The treatment modalities commonly used among this patient population are known to cause multiple gastrointestinal toxicities, such as mucositis, anorexia, alterations in taste and smell, nausea, vomiting, and diarrhea. Out of all the nutrition impact symptoms mentioned, mucositis has been identified as one of the most debilitating side effects. What happens in this condition is that the epithelial cells that line the digestive tract get damaged, and that leaves the mucosal tissue open to several clinical complications. In the lower part of the digestive tract, mucositis can lead to abdominal pain and cramping, nausea, vomiting, as well as diarrhea. But the oral cavity is the most common location for mucositis because it's so sensitive to the effects of cancer treatments. So in the mouth, it's common to see lesions that are reddened, edematous, and they're said to be very painful. The images here show patchy ulcerations in pictures A and B. Picture C shows the reddening that often comes with this, and picture D shows that bleeding can occur easily with these sores, even with minor trauma. The frequency of oral mucositis is 30 to 40% of the general cancer population. But among those with blood cancers, this range increases to 60 to 85%. So it's easy to see that symptoms such as these complicate eating, and this can lead to a significant decline in oral intake, increasing risks for the development of protein-calorie malnutrition. This is concerning because malnutrition is associated with numerous adverse outcomes, including cancer progression or recurrence, decreased response to treatment, delayed recovery, increased risk of infections, prolonged hospital length of stay, and in some cases, death. Unfortunately, even after much research, the available treatments for mucositis are limited and not that helpful, so this leaves medical providers to frequently turn to opioid pain medications to treat symptoms. For all these reasons and more, methods for preventing or alleviating mucositis warrant greater research priority. An effective treatment for mucositis could help preserve quality of life while increasing chances of survival among those with hematological cancers, which I should add is a population that is projected to grow significantly in the coming years. Certain amino acids utilized during cancer treatment have shown some promise with regard to preserving the integrity of the mucosal cells. Like glutamine, it's the preferred fuel for the cells that line the GI tract. It can be obtained through the diet through foods like wheat, corn, barley, peanuts, soybeans, eggs, and milk. But under normal circumstances, the body is able to make enough to meet everyday needs. On the other hand, during periods of metabolic stress or illness like cancer, glutamine levels become depleted, giving rise to deficiency, and this can lead to abnormal intestinal permeability, which is associated with multiple digestive issues. The amino acid glutamine has been of interest among researchers because it has shown it's shown to offer some protection against mucositis development in various cancer populations, but when it comes to those undergoing treatment for hematological cancers, the results have been less consistent. So, to understand the current research related to the use of glutamine supplementation among patients with hematological cancers, a systematic review was warranted to examine its effects on mucositis prevalence and intensity during treatment. The following research question was developed. Among individuals with hematological cancers, does glutamine supplementation decrease incidence of mucositis if administered within 4 weeks of beginning treatment, compared to individuals with hematological cancers undergoing treatment receiving placebo or standard of care administered within 4 weeks beginning treatment? There were many steps to conducting this systematic review. Briefly, I'll go over what the major steps were. I began by searching for primary research articles through the following databases: Embase, PubMed, and Scopus. Here I have listed the search terms that I used. I included trials if they were published after 1990. Study participants had to have hematological cancers, and they had to be on treatment. Controls could only receive placebo or standard of care. Mucositis had to be one of the measured outcome parameters. The amino acid could not be combined with other experimental compounds. Method of administration could be via oral, enteral, or parenteral routes. No age limitation parameters were set. I reviewed article abstracts to determine if the conditions of the inclusion criteria were met. Once I had the articles that met all my specified criteria, I started to compile all the information I was interested in, like the study design, age group of participants, type of hematological cancer, anti-cancer treatment modality, total participants. I recorded what the control group received and what the intervention group received, the dosage of the glutamine supplement, route of administration, duration of supplementation. When it was applicable, I recorded if and how adherence was measured. I noted rates of mucositis incidence, intensity of mucositis symptoms, duration of symptoms, if and what tool was used to evaluate mucositis. I recorded tolerance to the supplement regimen and adverse events. Here I included a flow diagram of the study selection process. It illustrates the number of studies identified, screened, eligible, and included in the final analysis. As you can see here, there were a total of 17 studies included in the final review. Here I'd like to share just some of the study characteristics. Altogether, the studies included 1,078 participants. Among all the trials, the type of hematological malignancy shared most commonly by the participants was leukemia, but many different hematological cancers were represented in the selected records. 6 of the trials tested the efficacy of glutamine administered via oral or enteral routes, while the remaining 11 examined the effects of parenteral administration of the amino acid. 9 of these 11 trials utilized glutamine-enriched parenteral nutrition. Various study designs were utilized. 10 of the studies were randomized controlled trials, 1 was a randomized crossover trial, 4 were retrospective cohort studies, 1 was a prospective cohort study, and 1 was a case control study. The study with the smallest sample evaluated 12 subjects, and the largest evaluated 193 participants. Assessment of mucositis severity varied widely across the studies. In the selected reports, the most commonly used evaluation tool was the World Health Organization grading scale. Other scales utilized were the Modified Walsh Scale and the Stanford University Hospital BMT Toxicity Scale. Some trials used subjective assessments, and in one of these, the researchers also evaluated use of opiate-based pain medications as an objective measure of mucositis. In that same study, days of parenteral nutrition dependency was also used as an indicator of mucositis severity. In another study, patients completed a multiple choice question daily, and that was followed by an objective assessment by a nurse. In one trial, the researchers conducted a sugar permeability test, daily mucositis scores, daily gut scores, and a citrulline concentration test. In 4 trials, the method in which mucositis severity was assessed was not disclosed. Of the 6 trials that examined the effects of oral glutamine supplementation, 3 reported positive findings, while the other 3 trials found no statistically significant differences between the intervention and control groups. Of the 11 trials that examined the effects of parenteral glutamine supplementation, there were positive findings noted in 5 reports. In these trials, the researchers found decreased incidence of mucositis and severe diarrhea. Duration of mucositis was reduced, and among those that did develop mucositis, it was less severe. 6 of the trials that tested parenteral glutamine supplementation failed to show statistically significant beneficial effects with regard to mucositis prevention or amelioration. In the study by Blay-Levens et al., the results of the lab tests they conducted were favorable, but this wasn't synonymous with protection against mucosal barrier injury. Here, I'd like to mention a few points on the supplement regimens utilized in the studies and what adherence to these regimens was like. There was some repetition in the dosages used, but for the most part, all different doses were used across the 17 reports selected. Duration of supplementation varied significantly across the 17 trials. Studies examining the effects of orally administered glutamine often reported providing the supplement in divided doses. In some studies, glutamine was mixed with liquids or soft solids. Ease of adherence to the supplementation regimen was discussed in 4 studies. Amino et al. Reported that adherence to the supplement regimen was not different when compared to the group taking placebo, and the supplement was noted to be palatable. But that wasn't the case for the other trials. For Ward et al., since they used a weight-based dose, they found that the required volume for certain patients was as high as 300 milliliters, which proved to be difficult for them to take. Also, the supplement solution was described as having a gritty texture, which may have aggravated nausea among some, and that may have further complicated ease of adherence. Coughlin et al. Explained that most of the patients in their trial required total body irradiation, which may have explained why many had limited ability to adhere to the supplementation regimen because they had more significant treatment-related gastrointestinal toxicities. And in the trial by Jeb et al., 4 out of 12 pairs of patients were excluded from final analysis due to one or both patients consuming less than 50% of the prescribed supplement dose, which suggests that adhering to the supplement regimen was not easy. The safety or tolerability of glutamine supplementation was discussed in 7 studies. Overall, these authors agreed that a wide range of doses of glutamine is safe over varying periods of time across diverse age groups, and the supplement is generally well tolerated. No adverse events were documented in any of the studies. It should be noted that glutamine supplementation might be risky for those with liver disease. Ward et al. Cautioned that hyperammonemia is a possible complication that can arise from supplementation with this amino acid. So they recommended for glutamine and ammonia levels to be monitored in future trials. And because of this, glutamine supplementation is not recommended for those with advanced liver disease. Anderson et al. Reported that there's a possible interaction between supplemental glutamine and a chemo drug called methotrexate. It appears this may be a favorable interaction because the amino acid can inhibit renal clearance of the drug, making cancer cells have increased exposure to it, but the greater methotrexate concentrations might worsen mucositis for the patients. So to summarize, 8 out of 17 reports noted some positive findings. When we look at the trials that were conducted on oral glutamine supplementation, we see a trend towards reduced average mucositis score and statistically significant decreases in use of opiate pain medications, reductions in parenteral nutrition dependency, less mouth pain, and decreases in occurrence of mucositis development. When compared to controls, parenteral glutamine supplementation was shown to have some protective benefits against incidence of oral mucositis and severe cases of lower gut mucositis, while reducing its duration and degree of severity. Beyond mucositis protection, in some trials, glutamine may have been responsible for some additional benefits, such as protection from significant weight loss during cancer treatment, protection from infections, which could be so helpful among this immune-compromised patient population. Healthcare cost savings may also be a benefit from glutamine supplementation due to decreased parenteral nutrition use, and because 2 studies found that those receiving glutamine had shorter hospitalizations than controls. Additional possible benefits from glutamine supplementation were decreased duration of fever and incidence of severe graft versus host disease during the first 3 months following stem cell transplantation. There are some limitations to take into consideration when interpreting the findings of this systematic review. The variable results reported in the studies reviewed may be due to the high heterogeneity of the supplementation regimens trialed and the patient populations that participated, making it challenging to identify which cohorts would benefit most from glutamine supplementation. Also, due to use of relatively small sample size, many of the studies may have been underpowered, so they were unable to identify significant differences in results. A major weakness of this review is due to the inconsistencies that were found across the included records with regard to assessment tools utilized to evaluate mucositis. While some trials used standardized grading scales, others used subjective assessments, leading to great variability in the interpretation of mucositis presence and severity. It's been noted in the literature that there's a lack of consistent scoring systems in mucositis research, and that gets in the way of progress aimed at prevention and treatment of this condition. With so many different assessment tools and parameters being used by researchers, it makes it difficult to compare results across studies. So before further trials on glutamine supplementation for mucositis take place, I recommend for the scientific community to reach consensus on a universally accepted assessment tool that is objective, reliable, yet simple, so that it's not burdensome for medical providers or patients. I would also recommend for future researchers to make greater efforts to refer back to previously conducted trials that showed favorable outcomes and replicate them so we can begin to draw more concrete conclusions. Due to the inconsistent findings of the studies reviewed, routine use of glutamine for individuals with hematological malignancies undergoing treatment cannot yet be recommended. Too many uncertainties remain regarding appropriate timing, duration, and route of administration of glutamine supplementation for the prevention or amelioration of mucositis. Despite the inconsistencies discussed, glutamine supplementation appears to have the potential to provide a protective effect against mucositis. With its wide safety margin, glutamine supplementation warrants further evaluation through large multi-center randomized controlled trials focusing on this patient population because of the degree to which they face this side effect of treatment. This brings me to the end of my presentation. Thanks so much for your attention, and I look forward to receiving any questions and feedback.